All right. Hi, everybody. This is Naomi. I'm one of the research assistants for Girl Group Records. We're here today with Dr. Jim Downs, who will be talking with us about his latest book. So Dr. Downs, would you like to introduce yourself and tell us a little bit about your research?
Sure. My name is Jim Downs. I'm a historian at Gettysburg College. I'm also the editor of Civil War History. My first book and this book are connected by my interest within the history of medicine and race. My first book, Sick from Freedom, examined the untold stories of epidemic disease outbreaks among formerly enslaved people at the moment of liberation. And then this book is a continuation. It's called Maladies of Empire: How Colonialism, Slavery, and War Transformed Medicine. In many ways, it's a sequel to my first book because I was interested in the 1866 cholera pandemic that plagued formerly enslaved people at the end of the Civil War. And I wanted to know more about how doctors understood the spread of infectious disease, how they developed efficacious protocols to control and prevent disease, and basically just how they understood the behavior of cholera. And that sent me to London, where I went to the Wellcome Institute, the British National Museum, British National Archives, and then the British Public Library, as well as many other archives within London and throughout the world. And what I basically did was sort of examine how doctors develop the field of epidemiology. And so today we're looking at COVID. We're looking at this massive pandemic that continues to plague the planet 2 years later after its initial sort of onslaught. And we're drawing upon epidemiological tools in order to narrate the epidemic, in order to control the epidemic, and in order to prevent further spread. And what I uncover in Maladies of Empire is that those very tools that we're using today developed by physicians when epidemic outbreaks began to spread among enslaved people, colonized people, and populations of soldiers during the 19th century.
I just got your book and I'm excited to get past the introduction since it arrived yesterday. So you already started to answer this question of how does your research help readers better understand medicine, including public health and disease transmission? Of course, we're still in a pandemic, so this is very relevant to everybody.
So I guess, there's a lot of different ways of sort of thinking about this. The one is that from the medieval period or even earlier, there was an understanding of contagion, which was basically just that epidemic disease spread from person to person. Oftentimes there were other narratives that sort of underpinned contagion, which were sort of efforts to sort of think about supernatural forces causing the epidemic, to miasma theory, which was basically just an argument that if you had any type of trash or rotten vegetables or corpse, what would happen is they would emanate poisonous vapors into the atmosphere, and those poisonous vapors would travel, and thereby people would become sick as a result of that, and then people would become contagious. What my work was really interested in thinking about were the generation of doctors who collectively began to refute contagion theory. Now, this is really important within the history of medicine because you're always going to be able to say, well, I know a doctor from 13th century Venice who didn't believe in it. Okay, there's that guy. And there's a lot of other people out there who debated it. But what we begin to sort of see is the scale and scope of doctors who begin to question contagion as the rationale for infectious disease, beginning in the 1750s and culminating in the 1850s with the rise of the Epidemiological Society. And partially what's happening is epidemiology develops as an analytical approach to understand the spread of disease. They're not just saying simplistically that this is just spreading from one person to person by human contact. They're looking and investigating the environment. So they're sometimes really committed to questions of sanitary improvements. That's one way that they're trying to develop an epidemiological analysis. They're really interested in counting. They're really interested in counting the number of people who become sick, the number of people who die, the number of people who are hospitalized, the number of people who recover. And then also, they're really also interested in counting, which is sort of not happening so much today, and it seems counterintuitive, but it is important, the number of people who don't become sick. So in other words, when they were developing quantitative analysis before the rise of microbiology, they were really reliant on numbers as a narrative, and they were using all kinds of numbers. They weren't selective with the kinds of numbers they were looking at. They were really trying to count as much as they could. So the quantitative approach, the numerical sort of assessment, that ultimately paves the way for biostats, which is a key sort of component within epidemiological analysis today. The investigation into environments, that's something, again, that we see today, whereas we're not just sort of saying COVID's spreading because, it's just this monster. We're looking at specific factors within social, cultural, and the environmental world, political factors, economic factors. I mean, one of the things that I said early on in the early part of the COVID outbreak was that there were high rates of morbidity and mortality among Black people in the spring, early summer of 2020. And people were like, well, what are the underlying conditions? Is it because Black people suffer from X, Y, or Z? And my argument was often poverty is an underlying condition. So in other words, that's a way of going into an environment and saying, when we actually look at these numbers of infection rates, it's not just about pure numbers isolated, but rather it's how we can put the number in context, and we can see that people who don't have access to healthcare, people who don't have access to doctors, people who haven't had access to these types of things automatically don't develop a relationship or have a physician or understand who to call or where to go the moment a pandemic happens. So there's ways that investigations into the social environment and political environment, we can see that in terms of how different political parties understand COVID. All of those things are what epidemiologists were concerned with even early on in the mid 18th and the mid 19th century. The other thing that I developed, and this was like kind of one of the most shocking discoveries, was the fact that when we think about was the ways in which aerial mapping and surveillance that become key components within epidemiology actually had their roots in colonialism. So one of the ways of thinking about it is, when COVID first started to break out, we began to sort of see maps, lots of maps. Oh, there's a flare up in Wuhan, Iran, Italy, the Pacific Northwest, New York City. Okay, so in one way you're like, wow, maps are really useful. Maps are really important because they can illustrate the movement and placement, the movement of the virus. This idea of mapping has its origins in colonialism. In other words, imperial endeavors depended upon maps because maps were ways to know things about places, but more importantly, they were about ways of controlling certain places. And so when disease broke out within the empire, they started relying on mapping technologies in order to understand it. Colonialism had already created the maps. Now there's two kind of maps. There's and I looked a lot of these maps of the New York Academy of Medicine. There's these beautiful, like pictorial, graphic maps, the traditional maps. But then there's something else I noticed when reading the records more closely. There's the idea, there's narrative mapping, is what I call it, which is to say that what you have is, when you have British colonial officials or even American military officials stationed throughout a particular theater, stationed throughout a particular place, all of a sudden you can deploy a circular to them, send them a message, tell me what's going on in your region. And they immediately start firing back responses about health. And so what initially happens before the creation of the pictorial map is a narrative map, which is basically descriptions of outbreaks in various parts around the world. So today in 2020, 2021, we're talking about the Omicron variant, we're talking about Delta variant, we draw on maps. In the 19th century, they drew on maps. Those first maps were verbal, they were narrative maps. And then later, by the end of the 19th century, they more familiarly became the kind of pictorial maps. But the idea of mapping is a technology, is a byproduct of colonialism. So we don't really think of sort of mapping in COVID as actually using a tool created during colonialism, but it's true. Similarly, just because my book covers the Crimean War and the Civil War, mapping was really useful in any type of military engagement. Mapping was really useful to sort of know your terrain. All of those technologies become incredibly useful, used by to map virus, map outbreaks. And so essentially the same officials who are monitoring movements of troops, who are monitoring, as I mentioned in the last chapter of my book, the movement of Native Americans throughout the West, they're now drawing on those same methods to map disease spread.
That's amazing. I just learned so much, and it puts a lot of things in my head into conversation that I never thought about. I'm excited to spend more time with your book. I can't decide what I want to assign in the spring now, but that's a different conversation. So do you have a favorite anecdote that either made it into the book, or maybe a favorite anecdote that didn't make it into the book?
Oh, wow. Okay, a favorite anecdote that didn't make it into the book was I found, so one of the things that I'm looking at all the time are sort of medical journals and medical treatise from the 19th century. And I found, and what I'm arguing throughout the book is that I'm only looking at a fraction. There's like almost seemingly infinite number of records. But what I found were records by a record by a Philadelphia physician who's talking about quarantine methods and what's effective and what's useful in the 1850s and the 1860s. And he's drawing on evidence from the Middle East. And he actually says, it's really important that to stand 6 feet apart from individuals in order to avoid catching the epidemic. And then he goes on this whole other description about locking up the windows and sort of basically what we would understand as a lockdown or a really strict quarantine. But I found that really fascinating because I read it on the plane in March of 2020. This is like COVID had like already come out, but it was like already broke. But it wasn't, it was right before, it was literally the night, I can tell you, it was literally the night that Trump announced the ban on flying internationally and was calling, it was a kind of this moment where he's calling all Americans to return home. And I was flying from New York to Los Angeles, and I was like literally just about to land in LA. And I thought, oh my gosh, do I have to like get on a plane and turn around, or am I going to be stuck in Los Angeles? Well, that's a whole other thing. But as that's happening and it's coming across the speakers and the news and the email, blah, blah, I'm reading the source about social distancing. And so this idea of social distancing, we sometimes like attributed to, oh, it's Fauci, it's the CDC, it's WHO. No, it's these ideas about learning how to social distance resulted from biomedical social experiments that happened as a result of colonialism in other parts of the world. Mm-hmm. Physicians understood what worked. They saw what worked. They wrote to each other about what worked. And then they basically took that information, published it, sent it back, and then it appeared in a medical journal in the US. And then a particular official in the US would then write about it and talk about it and publish it. So that, again, when we think about something like social distancing, as every historian always loves to say, not new. There's a history to it. But the other thing is that it resulted from experiments as well as from lived realities of epidemic outbreaks in other parts of the world that then began to inform policy here. So I think it sort of also upends these notions of American exceptionalism, but it also shows, I think, a kind of genealogy of public health, which is not necessarily simply just an American phenomena, ideas that developed here in the US, but actually can be traced to other parts of the world.
Wow, that's amazing. Okay, so shifting ever so slightly and thinking broadly, how does your research help us better understand the Civil War era?
Right. So this book began with a question from the Civil War. It began as a result of my first book, Sick from Freedom. And basically, I wanted to know how the government was able to develop an effective protocol to prevent the further spread of the cholera pandemic during Reconstruction in 1866. It led me to London. It led me to stretch the parameters of the research from 1866. I was like, I got to London. I'm like, wait a minute. Can't start in 1866. I got to go back to 1850. Once I was in 1850, I was in the 1830s. Before I was in the 1830s, I'm down in the 1750s. And so basically, this is a global history of the Civil War. When we think about the Civil War and we think about a global history, some studies will be like, oh, I'm doing the British reaction to the Civil War. That's cool. Or I'm doing how European trade and economies interacted and influenced the American economy, and whether they, sided with the Americans, the Union, or whether they sided with the Confederacy. Okay, that's fine. Other projects could sort of look at war as a sort of broader concept and pick out the US Civil War as well as other wars that are happening in the 19th century. This project is saying that ultimately, to understand medicine and public health within the Civil War, we can't start looking in 1861. We certainly can't start looking in 1850s. We have to go back a lot further. We also have to look at the fact that many physicians, both in the Confederacy and the Union doctor, were learning from and gaining information from physicians throughout the world, and that the tools and protocols that they developed to stop the spread of cholera in 1866 didn't start in 1865. They actually have the roots back into the 1750s. And so the other part of it is to say that we think about the Civil War as an isolated subject. We think of it as a fight between the North and the South. In some ways, the Civil War from a medical perspective sort of aligns very clearly with the Crimean War. And that is to say that they're both modern wars. They both use journalism for the first time in many ways to report about what's happening on the ground. They first deploy civilian corps of women to go to the battlefield to provide care and comfort to soldiers. And they both develop new medical practices, not only epidemiological practices, which is the focus of my book, but even surgical innovations. And other historians have talked about this as well. So there's a way of sort of seeing the Civil War within a broader context, but also to sort of see, and this is like at the core of my book, how does war create a captive population to be studied? And how does slavery create a captive population to be studied? How does colonialism create a captive population to be studied? So in other words, if we're, as historians, we're like, oh, there's books over here on colonialism, there's books over here on slavery, then there's books over here on war. And what I'm saying is, how could I conceptually begin to identify patterns or begin to identify tropes or themes or connections that actually show similarities in these things? And of course, there's the obvious differences clearly, but what I'm looking at is the fact that all of these major transformations within the period of a century create captive populations that allow doctors to begin to understand the spread of infectious disease. And that actually leads to the creation of epidemiology, and then ultimately to its prominence as a branch of science.
And the next question is, what would you like to see the forthcoming docuseries accomplish?
I really want to see what's happening on the ground for all kinds of people, and not just, we know what's happening. We have a lot. I mean, I live in Gettysburg. We have a lot of material on the experience of soldiers. There's more to know. about the history of soldiers, but there's also the ways in which the war had rippling effects across many different populations among civilian populations. One of the major arguments I got into with my first book on the eve of its publication was a huge debate within the field about mortality. And so ever since God was a little boy, everyone said, 600,000 people died during the Civil War. And right before my book, Sick from Freedom, came out, what is he? I don't even know what he is. David Hackett. He's a social scientist, broadly defined, but basically reviewed census records and basically said, okay, it's actually not 600,000. The morbidity and mortality rate is actually probably higher to 700,000 based on 800,000 based on his evaluation of the census. And I said, I sort of, what is the expression that they use on Twitter? I bounce back, no, clap back. I clap back. And I was like, and what about the Black people? And he said, well, I'm not going to wring my hands over the Black death because I can't find evidence. It was like this whole thing. He wasn't being purposely dismissive. He was speaking to a silence in the archive, which I understood and which I completely am sympathetic to. It wasn't like there was a box of sources and he was like, I'm not going to look at them. The records are thin. But he wrote, like, I'm not going to wring my hands. That was something I can remember a decade ago. And I said, well, wait a minute, let's think about this logically. We have an army camp where more soldiers are dying from infectious disease from battle. And by infectious disease, I don't mean gangrene. I mean pneumonia, sometimes smallpox, oftentimes dysentery, among other kinds of infectious diseases that don't necessarily correlate to our contemporary pathology, so I won't waste your time in sort of naming them, but more dying from infection. Formerly enslaved people entered into an environment plagued by disease. Oftentimes, their refugee camps, this is something that my book talked about and later historians have talked about, were built adjacent to and next to and even within the Union camp. Yet when we do the when we do the mortality records count, we're counting the white people, but we're not counting the Black people because the white people are soldiers and the Black people are civilians. And I was like, it doesn't, no. This is what I say, more on the ground. There is enormous amount of epidemic disease among formerly enslaved people, and it continues to be overlooked. I mean, my book, Sick from Freedom, got a lot of attention when it came out. It was on the front page of the New York Times art section, blah, 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 blah. And it was great, I mean, there's a way you could be like, oh, that's ego downs. No, what I'm thinking about was really trying to, as I mentioned in the book, as I said all along, really trying to call attention to the death of these people and the suffering that they faced. And what happened is 10 years later, if it was a true and false question on an exam, most historians would say, oh, yeah, I think, yeah, there was mortality. But it's the same old political history that seems to dominate the history of the war and the history of the war after and the history of the Civil War era. And in one book on Civil War, refugees, there's a passing reference, oh, there was also death, but that's not what I'm going to look at. It's like, that would be like saying, like, I'm going to look at the January 6th insurrection and I'm not going to look at the pandemic. I mean, I know it's there, but I'm just going to kind of move on. Like, the way that historians have so been able to disaggregate pandemics and epidemic disease from the political moment and not see the connection is like astounding to me. And the way that they refuse to sort of look at the ways in which most Black people knew someone who died of disease, and most Black people were starving to death and were hungry and had no clothing during the war and were suffering and ran off the plantation with the clothes on their back. And yet the narrative that predominates remains the political narrative, and the political narrative matters. And Du Bois did a wonderful job, talking about Black people as political actors during Reconstruction. Eric Foner, my advisor, did a terrific job talking about it as well. Elsa Bartley Brown, who most people overlook, did a wonderful job explaining Black political mobilization. But a lot of what's happened recently has been really derivative, and it hasn't really helped us to understand the lived experience of people on the ground. And that's only for Black people. That's my research. There's also lots of other populations of people. We're thinking about Native populations, we're thinking about immigrant populations. I mean, the war has a lasting effect, and the war's effects also can be felt not just until 1865, 1870, but even into the 1880s, even if we've now coined that, oh, that's moving into the Gilded Age. Well, for a lot of people, it's still, they're living with the effects of the war.
Wow, those were great and very thorough questions, but is there, or answers, is there anything you maybe want to add? No.
Okay. I think I didn't want to go too far, but you've asked, like, I want it also to be interesting, and I want people to sort of think about when I say Black medical conditions during the Civil War, it's less about trying to draw attention to my book, and it's more about trying to draw attention to the experience of human beings and what their experience was on the ground, and the fact that we know that more Civil War soldiers died from infectious disease than from battle. So what did that mean for all of those other people? And we know the political story. We still aren't clear on the medical realities of the war. I mean, there's so much else out there. And one of the exciting things is that a lot of the records are now becoming digitized, they're becoming available. They're able to do things that I didn't even know were possible. So I think there's so much more out there to do.
That's great. Thank you so much. And just real quick to our patrons, stay tuned for more of these. And we are greatly appreciative of all of your continued support. We'll see you soon.